going to teach you guys how to do ultrasound guided IVs. I'll go through just how to use the machine at first and then the technique for putting them in, okay? So starting from the top, the power button's back here. Very simple. It'll show you this screen to start. You're going to go hit scan. And then you're going to choose your probe, which is under this green box here. We always use the linear probe, the short one here. So you hit under here and it'll show you here the two pictures of the different probes. It's this one on the left. If you're not sure, when you touch it, it'll show up here, so you'll know if you're on the right one or not. Then there's different settings under here. There's venous, PIV, nerve, musculoskeletal, and arterial. We're going to use PIV for this, so you hit that, and then the blue button scan down here. And then what you see on your screen here, some important things is the centimeter marks are here on the right side. So this is how deep you're going to go. I always like to put on the center line, which is in the middle of the screen here. That gives you a dash here, and that correlates with this center line in your probe to make life easier. The other important thing is this blue box up here is the right or left of the probe. So this little knob here on the right correlates with that, so that you always want to have that lined up. So when you're scanning your patient, you're going to have that it's on the left, you're going to have it on the left, so you know which direction you're going in. Okay? So the basics with that. Then you're going to get your ultrasound gel. Something that's important too that you can also adjust on here, we talked about the centimeters over here, is the depth. So you can increase the depth going down or up just by hitting that button. The other thing that's really important is this gain. So see how it's pretty dark right now? We want to adjust that. So there's this dial that says gain up to right here. And so you can just literally put your finger around it, dial around it to get a picture that you can see a lot better. When you're looking for your vessel, a few important things. One, you want to know if it's an artery or a vein, right? We know in general anatomy where arteries and veins are, but if you're not sure, this isn't a good indicator because this is not a real human, so I'll show you on myself. Veins in general, I'm gonna put right here. They're usually more superficial, not always, right? But when we press down on them, they're going to easily collapse. So do you see the vein right at the top there, that black circle? Easily collapses, and it's also not winking at me, it's not beating, right? Compared to, if I look at my radial artery, which is a similar size vessel right there, you can't really, I'm not pressing on it yet, so you can't really tell, but when I press down, do you see it pulsating? Right, so. Pretty obvious, but just important to check with every vessel, push down on it and see. In general, you're going to want to have like a very light touch with this. Very generally, you're not going to want to push down. People kind of generally do push down too hard and then it collapses the veins. So if you're going around and scanning and you're pushing down, you can't even tell I have a vessel there, right? But see if I pull up on it, look, there's a vessel right there. So technique with this, basically make sure you have a light touch. And then also when you're scanning your patient, what I see a lot of people do is they scan around like this, but it moves, very freely. You're not grounded to your patient, so it makes it very difficult. So what you want to do is you want to ground, anchor your hand on your patient. So hold this more towards the bottom, and you want to hold it flat on the patient, not, any which way. It'll show you, like I can move it around, it's still kind of showing me a picture, but you want it just nice and flat on your patient. And then once you find a good vessel, you're going to want to walk it up and see where that vessel goes, because it might be going straight up the patient's arm, it might be going to the left or the right a little bit. So just go ahead and walk that probe up and see, and you also want to see, does it become more superficial at a certain point? Is it going to be easier for me to hit at a certain spot? Or is it getting deeper? Does it branch out? Like this one comes together here. So you're just gonna wanna take a look and see where's the best place for me to hit this vessel. Let me find a better one that's not so deep. All right. A little lighter. Okay. So for example here, so we see this one's a little more superficial. I'm gonna walk it up. It kind of stays there, right? It's not getting any closer or further away, but it's nice and straight. It's patent. So I'm happy with that. I don't know why that's right there, but whatever. I think there's an air bubble right here. Anyway, so once you're confident and you have your vessel that you want to hit, I'm going to notice, okay, my depth. So I'm about almost a centimeter deep, right?
Yeah.
So when you insert your catheter, you're going to know you're not obviously inserting it straight down. So where you're going to hit that vessel isn't going to be right there, right? So, but if this is the spot that I want, that I think is most superficial, that I want to hit that vessel at, I'm going to move my probe just a little more distal, right? Because that way I can see sooner. Oh, that's where the air bubble is. All right, I don't want to do that. Okay, there, so that I can see my probe or my catheter right away. All right, so now I'm going to start to put it in. Some few important points are what I call it the leapfrog technique. There's different names for it. I don't know what they teach in your class. But basically what you're gonna do as you put this in is you're gonna walk forward. First, the probe a few millimeters, very slight, and then your needle. Probe and then needle. So it's gonna look like you're just walking it down slowly. So you always wanna see your needle tip, okay? So you know how I told you guys to always keep your probe flat on your patient? That is the case except for right when you put the needle into the skin. Since we always want to see the probe on here, we're actually going to tip it up just a little bit. Have it right in the center. And then that way, when you first stick your patient at like your 30 to 45 degree angle, you can see the probe right away on your screen. So you'll be looking at your patient right when you stick them with the needle with the catheter. You put it flat, but once you have it in their skin, you're gonna start looking at your screen and you're gonna stay looking at your screen. So I put it in there, it's flat, and then I'm gonna look for my catheter, which is the hyperechoic or the white part that's flickering up on that screen. And then we're gonna do that leapfrog technique where I can see the tip of my catheter. So I'm gonna move my probe just a few millimeters distal till I'll lose my tip. See, it's gone? And I'm gonna push my catheter a little more till I see it again. And then I'm gonna lose my tip, push it a little more till I see it again. Lose my tip, push it a little more till I see it hits a bullseye in the center of my vessel. And then you're gonna keep going, because just because you're in there doesn't mean, it means the needle's in there, right? But not necessarily the whole catheter. And you could also be looking at a side of it, it could have gone through. So again, you wanna keep going with that leapfrog with lose the tip, and then you're gonna wanna flatten out a little bit, right? Because I don't need to go deeper. And I'm gonna make another bullseye. I'm gonna lose the tip and make another bullseye. Okay, so you're gonna keep advancing both the catheter and the needle like this. I do at least like 3 bullseyes, but you can keep going. You can put the whole catheter in there if you like. But you keep doing this where you see it, great, I'm in the vessel. Now and you're just moving a few millimeters with your ultrasound down and make another bullseye. So once you feel confident that you're like, okay, I've made at least like 2 or 3 bullseyes, I'm very confident it's in that vessel, you can put your probe down. Go ahead and just advance your catheter like you know you do. Remove your needle and you have your IV, make sure blood return. You can also confirm it with the ultrasound, both this way. So I'm looking on that white thing in the black. Black is fluid, right? I can go over that. So in there, and then you can also look at it from the side view if you'd like. So I can see. There's my IV nicely in the vessel. I have my thumb over this because I don't want to insert any air into our phantom blob is why. So I ask you guys to do the same too when you put it in. Confirm it, and then we'll pull it out because we don't want to just leave it there and everything like that. Okay? All What questions do you guys have?
So one of those points that we've seen in the ultrasound is bringing. I mean, yeah, the technique is like 15 degrees to approach. Oh, yeah, 15 degrees, and once you're in the center, they can bring it down.
Right.
They forward it.
Yep.
And it's a very hard skill and challenging to chase it like the leapfrog.
Yeah,
it's,
that is
that's
the
a
hardest
very.
part for sure.
But I think that's the way to maximize the benefit of using the ultrasound. And since where the challenge is, you get excited when you're in the center. And again, like it does not stop there. That's only like a part of it.
Exactly.
The challenge and like the most important part and maximizing the use of this ultrasound is like chasing it like the leapfrog you said.
Exactly.
But the one that we have observed is like sometimes we carry the ultrasound that is not sterile.
Yeah.
Yes,
sure.
I've seen that multiple times, and it should only be the sterile. It should only be the sterile lube that is in there.
It is. Yeah.
It's probably about it.
I clean off my probe too
Yeah.
beforehand. And,
Yes.
you know,
Yes.
you are
Yes.
sticking. You know, obviously you're cleaning off your patient here, and you're pulling this up, so the only part there. But then you're just ultrasounding where you aren't sticking your patient.
Yes.
You know.
Yes. True. Yeah.
Yeah, but yeah, definitely making sure that's clean and sterile is
It-
definitely
ex-
important. Yeah.
Yeah. Exactly. Yeah. Right. Yeah. Skin prevention. One of this. I think the bringing of the big ultrasound comes with the personality of like a little bit obsessive compulsive. I want more kind of like.
Sure.
Well, thank you so much.
You're welcome.